There's one simple thing you can do each morning before coffee, before breakfast that may naturally lower your blood pressure, and it only takes 2 minutes. No medication, no intense exercise, just a small, gentle habit that sets your body up for calm, steady blood flow throughout the day. You might be surprised at how something so simple can have such a powerful effect on your heart and blood vessels. But once you understand the why and how to do it right, it just might become the most important 2 minutes of your morning routine. So stay with me, because in the next few minutes, I'm going to show you exactly what this habit is, how it works inside your body, and how you can start using it tomorrow morning. High blood pressure is often called the silent killer, and for good reason. It usually comes with no warning signs, no pain, no symptoms until it's already putting pressure on your heart, kidneys, brain, and eyes. By the time most people discover they have high blood pressure, it's already been silently wearing away at their health for years. In fact, over 60% of adults over the age of 55 are living with elevated blood pressure. Many are taking medications, and yet their numbers still aren't where they should be. Why? Because blood pressure isn't just about the heart. It's about the vessels, the tiny tubes that carry blood throughout your body. It's about the kidneys, which regulate fluid and salt. And more than anything, it's about your daily habits, how you sleep, how you breathe, what you eat, and yes, what you do first thing in the morning. And that's what makes this one morning habit so powerful. It doesn't treat just the symptom, it speaks directly to the root of the problem. Let me show you how. So here it is, the one habit that can begin to shift your blood pressure naturally. Every morning, within the first 10 minutes of waking, I recommend drinking a glass of warm water, but not just any water. It should be mineral-rich, gently warm, and taken on an empty stomach. You see, after 6 to 8 hours of sleep, your body is mildly dehydrated. Overnight, you lose fluid through breathing and sweating. This makes your blood slightly thicker, raising your blood pressure, especially in the early hours. But warm water changes everything. Unlike cold water, which can constrict blood vessels, warm water gently dilates them. It softens the arterial walls, improves circulation, and reduces the pressure on your heart. Now, here's what I recommend to make this habit even more effective. Add a pinch of Celtic salt or a slice of lemon. These aren't just flavor boosters. Celtic salt provides over 80 essential minerals that support electrolyte balance. Lemon stimulates digestion and helps activate your sodium-potassium pumps, the tiny systems inside your cells that regulate fluid and pressure. As I often tell my patients, 1 glass of warm, mineral-rich water in the morning is like a gentle wake-up call for your blood vessels. It's more than hydration, it's a message to your body. You're safe, you can relax, and when your body feels safe, your blood pressure begins to respond. Let's take a moment to understand why this simple act of drinking water in the morning has such a powerful effect on your blood pressure. When your body is even mildly dehydrated, something important happens: the volume of your blood decreases. And when there's less fluid in your system, your body responds by narrowing your blood vessels, a process called vasoconstriction. This makes it harder for your heart to pump blood, and that naturally raises your blood pressure. Now, think about what your kidneys are doing. They're working around the clock to filter your blood, balance salt, and regulate fluids. But when you're dehydrated, the kidneys begin to hold on to sodium and water, trying to protect you. This triggers hormones like ADH, antidiuretic hormone, and renin, which cause the blood vessels to tighten even more. It's the body's survival mechanism, but in people with hypertension, it can make things worse. What water does, especially first thing in the morning, is reset this system. It gives your kidneys the signal: there's enough fluid. You don't need to hold on to salt. You can let go now. And when the kidneys release that tension, so do your arteries. Your blood vessels become more supple, more relaxed, and the pressure inside them naturally begins to drop. This is why I always remind my patients: hydration isn't just about thirst, it's about flow. And when blood flows with ease, pressure doesn't build. Sometimes, the first step to balance blood pressure is simply a glass of water. How do you know if your body is dehydrated in the morning even before you feel thirsty? There are a few subtle signs I often ask my patients to watch for. First, do you ever feel lightheaded or dizzy when you get out of bed? That drop in blood pressure when you stand, called orthostatic hypotensionis, often a clue that your blood volume is low due to overnight fluid loss. Second, check your mouth and eyes. A dry mouth or gritty, tired eyes in the morning are classic signs that your body didn't get enough hydration during the night. Third, if you measure your blood pressure and find that it's consistently higher in the morning than in the afternoon, hydration may be part of the picture. Morning spikes are common in those with high blood pressure, and dehydration can make them worse. And finally, look at your urine. If it's dark yellow or concentrated when you wake up, it's not just your bladder talking, it's your blood saying, "I need water." These signs may seem small, but they're your body's early messages. They're saying, before coffee, before breakfast, please give me water. Listening to them may be the first step toward balance. So, how exactly should you do it? Let me walk you through the way I guide my own patients. Each morning, as soon as you wake up, pour yourself a glass of warm water around 250 to 300 milliliters. Not hot, not cold. Just comfortably warm to gently ease your system into the day. Now, to that water, add 1 slice of lemon. This helps stimulate digestion and provides a gentle alkaline effect. If you like, you can also add a pinch of Celtic salt, or, for some people, half a teaspoon of apple cider vinegar works beautifully. Each of these additions helps support mineral balance and opens the channels that regulate blood pressure. Sit somewhere quiet, take a few deep breaths, and sip the water slow over 2 to 3 minutes. Don't rush. This moment is not just for hydration, it's your daily message to your body. You are safe, you can relax. After that, give your body about 15 to 20 minutes before eating breakfast. Let the water work through your system first. Let your cells wake up fully before asking them to digest food. This isn't just a drink. It's a signal sent through warmth, minerals, and intention. This is not just a drink. It's a signal to your body. You are safe, you can relax, and that's when healing begins. So, to recap, just 1 glass of warm, mineral-rich water each morning may be all it takes to begin lowering your blood pressure naturally. No pills, no side effects, just a gentle habit that supports your vessels, your kidneys, and your peace of mind. Try it for 7 days. Watch how your energy shifts. Notice how your mornings feel. And most of all, see what your blood pressure has to say. If you've tried this habit and noticed a change, share it in the comments. Your story may help someone else choose healing too. And if you find value in natural health like this, don't forget to subscribe to Timeless Health. We're here every week with new insights to help you age stronger, feel lighter, and live better naturally. Until next time, this is Dr. Emily Thompson. Take care of your mornings, and your heart will thank you.